Okay, we're back. And the last slide in this series, we're going to be talking about sex influence disorders and characteristics of autosomal recessive disorders. So, first thing, let's realize that ordinarily autosomal recessive disorders occur with equal frequency in males and females. But some AR phenotypes are sex influence, which means that they're expressed in both sexes but with different frequencies. An example of this would be hemochromatosis, which is a disorder of iron metabolism with enhanced absorption of dietary iron, which then leads to iron overload and pathological consequences. And the disease phenotype is more common in males. The lower incidence in females may be, well, it's actually 1/10 of that of males, may be due to the lower overall intake of iron, and plus, of course, the increased iron loss through menstruation. Anyway, this is not completely known, but this is an example of a sex-influence disorder in autosomal recessive or the single gene disorder. So we should talk about the characteristics of autosomal recessive disorders in general. And one thing that's important is that if a disorder appears in more than one family member, typically is found only within a sibship, and a sibship, if you remember, is the relationship between brothers and sisters, but not in other generations. And this recurrence for each sib of the proband, remember the proband is the person who has the disease, is 25%. And it is more common with consanguinity. Remember, consanguinity is when there is some inbreeding within the family, and this is especially true for rare diseases. We just talked about Tay-Sachs, for example. Usually, males and females are equally likely to be affected, as says above, but there are rare exceptions. So remember that a new mutation is almost never a consideration. Parents of an affected child are asymptomatic carriers. So we've learned a little bit about autosomal recessive diseases and consanguinity, for example. We've looked at some of the causes, but basically we've been looking at how to build a map, a pedigree chart, illustrating an inheritance pattern, particularly for single gene disorders, in this case, autosomal recessive disorders. And the reason for this is so that we can counsel our patients and make observations, perhaps predictions. Although we cannot control for everything, we should at least have an understanding as doctors in how to give basic genetic counseling to our patients.